Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have a fascinating and in-depth show for you tonight. We're talking about foot and ankle treatments and how the team of St. Luke's specialists can help. We'll be joined by a panel of medical experts from orthopedics, podiatry, and physical therapy, hearing patient stories of success and taking questions from our viewers. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at foot and ankle care with the St. Luke's University Health Network team. Stay tuned. Thanks for joining us. Let's get started. We have an excellent panel of guests joining us. Meet James Lockman. Dr. Lockman is an orthopedic surgeon specializing in surgery of the foot and ankle, including minimally invasive foot and ankle procedures. He completed his medical degree at the Lewis Katz School of Medicine, Temple University in Philadelphia, and his residency at Temple University Hospital. Dr. Lockman then completed his fellowship in orthopedic foot and ankle surgery at Duke University Hospital in North Carolina, where he learned how to perform minimally invasive surgery of the foot and ankle. Dr. Lockman is a member of several prestigious organizations, including the American Academy of Orthopedic Surgery.
So I have a family history in orthopedic surgery. It was something that was joked about as I was growing up, that I really had no choice but to become an orthopedic surgeon, but it turned out to be true. The potential for growth, the potential for innovation, and the potential to help patients who really didn't have very many options just a short time ago is what drew me to foot and ankle surgery. The nice thing about being a foot and ankle surgeon is if it's a condition that someone's been dealing with for a while, they know how to deal with it better than anyone, and they can continue to deal with it as long as they can tolerate it. But if it gets to a point where it affects their quality of life so significantly that they can't deal with it anymore, then that's the time I recommend, coming in and seeing a foot and ankle surgeon and getting taken care of. I recommend orthopedic surgery at St. Luke's because I think everybody on the team has the same goal. We're not looking to book every surgery that comes through the door, but here we're treating each patient individually, and we're trying to avoid surgery as much as we can. We're going to give them our best recommendation, whether it be surgical or non-surgical, each time we meet someone new. Conditions that people come and see me for are everything from the rudimentary sprain to chronic conditions like arthritis. I also deal with sports injuries, so a lot of athletes come with Achilles tendon tears. I see everything from the knee down, and that can keep you busy in very many different ways.
Dr. Lockman, can you tell me a little bit more about foot and ankle surgery and when surgery is most appropriate for patients?
So foot and ankle surgery is a really broad term. We do very many things, from the common bunion surgery to the less common ankle replacement. It's kind of everything in between. Deformity correction, sports injury. Those are all things that fall within the realm of foot and ankle surgery. But most things that come through the clinic end up getting trials of non-operative treatments. And those non-operative treatments include anything from shoe wear modification, activity modification, to orthotic manufacturing, physical therapy, even just avoiding some things that bother you.
Joining our panel next is Brent Bernstein. Dr. Bernstein is a board-certified foot and ankle surgeon and treats everything from simple foot problems to the most complex lower extremity diseases. Dr. Bernstein has been in practice for 25 years, having graduated from Temple University School of Podiatric Medicine in Philadelphia. He completed his residency in foot surgery at Delaware Valley Medical Center in Langhorne and completed a year-long fellowship in limb salvage in Atlanta, Georgia. Dr. Bernstein serves as an investigator in dozens of clinical research trials, speaks at scientific conferences worldwide, and teaches future foot and ankle surgeons as the Assistant Director, Podiatric Residency Program for St. Luke's University Health Network.
My name is Brent Bernstein. I'm a surgical podiatrist at St. Luke's. I started out actually as a chemistry major. I decided to go pre-med, and our school had a pre-podiatry program. I quickly realized that it was really up my alley. My practice is a little different in that I treat more standard podiatry part of the time, but a lot of my time is spent with more exotic or in serious things. I had decided that I wanted to specialize in these more significant complications like bone infections and Charcot. So I did additional training in Atlanta on those procedures, learning how to use surgical apparatus such as external fixation, and learning how to do flaps and grafts and things that many podiatrists aren't trained to do, so that I could help these patients with these problems. When I can do surgery and help someone, it gives me confidence that I'm doing what I was meant to do.
Dr. Bernstein, you often hear of foot and ankle problems that can arise in diabetic patients. Can you tell me the relationship between diabetes and foot and ankle problems?
So it's interesting. So a lot of people think that having diabetes is going to predispose you to absolute problems with your foot and ankle, and that's not true, because well-controlled diabetes insulates you. You're really not going to have any more foot and ankle problems than a non-diabetic. What we're really talking about is poorly controlled diabetics, diabetics who have not managed their glucose, their sugars have been high in their blood for 5, 10, 15 years, and they develop nerve damage. And almost all the foot and ankle problems that we deal with are really due to that nerve damage. They don't feel their feet. So the nerve damage will allow them to get wounds, infections, even break bones without having pain.
Things that really can be controlled, and we're going to talk a little bit about some of the options that diabetic patients might face later in the show. Thank you so much for being here. Let's meet our final panelist, Matt Babbitt, a board-certified clinical specialist in orthopedic physical therapy and certified podorthist. Matt completed his master's degree in physical therapy from Old Dominion University in Norfolk, Virginia, and his doctorate of physical therapy at Arcadia University in Glenside, PA. Matt specializes in custom foot orthotics and completed training to become a certified podorthist at Temple School of Podiatric Medicine. Matt specializes in foot issues including plantar fasciitis, heel pain, tendinitis, and ankle sprains. Matt is also McKenzie certified in mechanical diagnosis and treatment of the spine. Matt frequently lectures about physical therapy and orthopedic injuries and teaches in the orthopedic residency program for St. Luke's University Health Network.
A podorthist is someone who has specialized training in modifying footwear and devices that could support the feet and lower extremities. Being a physical therapist and podorthist go hand in hand. I've always had an interest in the foot and ankle, partly because I've always had foot problems and I have very flat feet, and started using orthotics and saw the benefit of that. So that caused me to be a little bit more interested in it, and so I pursued further training to specialize in that. I think what kind of drives us and keeps us going in this profession is when you see someone who's been limited by pain or dysfunction and see them get back to doing the things that they want to do. St. Luke's is just a great network. The number of specialties and people who have done advanced training and really take pride in what they do and strive to be the best, so you're just guaranteed to get good care.
Well, Matt, I learned a new word, podorthist. Can you tell me what it means to be a certified podorthist, and what does that offer patients?
Yeah, a podorthist is someone who has completed some specialized training in foot and ankle, including the fabrication of orthoses and other modifications of footwear.
And when does this come into play for patients?
Anytime someone is dealing with a foot and ankle problem, especially if they need orthotics or a footwear modification, this could be useful.
This is pretty common because a lot of people need orthotics, and I would imagine it's something that you can treat pretty often and help them with a lot of issues. Thank you all for giving us a better understanding of foot and ankle treatments at St. Luke's. Coming up, we'll dig deeper into what conditions can also be treated at the Orthopedic Center. We'll be back after a short break. You're watching St. Luke's Health Now.
It was a normal family ski trip, and then in one moment, everything changed. We had had a great 8 days, and on our last ski day, we were coming down a trail that was pretty steep, and the light was kind of low because it was getting to be dusk, and I fell and ended up breaking my ankle, and then met with Dr. Lockman and had surgery a few days after that. I was in a splint for about 3 weeks. And then after that, I transitioned into crutches with a sneaker, and then over the next, I think it was 3 to 4 weeks, gradually progressed from partial weight bearing to full weight bearing walking. So at this point, 6 months out, I'm pretty much back to doing everything that I was doing before, with the exception of I haven't skied yet. So I would definitely recommend St. Luke's to someone who has an orthopedic injury, because I think that the whole medical system is really great. Every single person I came into contact with had a great attitude and was very encouraging. Dr. Lockman just told me that it would be fine for me to go back to skiing this winter, which I'm really excited about.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our audience for being here today and providing us with questions, and we'll get to those later in the show. But now, joining me is an important panel of medical professionals, Dr. Lockman, Dr. Bernstein, and Matt Babbitt. We've started to discuss the basics of foot and ankle care. Now we want to get a better understanding of what foot and ankle conditions our team at St. Luke's treats. Dr. Lockman, let me start with you. How important is care to the foot and ankle? We go through a lot of things, just our day-to-day life, wearing high heels, sports that people play, and how do you make sure that you can keep your feet and ankle safe throughout your lifetime?
Yes, the foot and the ankle is in a unique position, literally, that it sees way more force than any of the other joints in the body. For instance, just walking, your ankle transmits about 3 times your body weight with each step. Going down the stairs, it's about 5 times. Anytime you're jogging, it can be up to 10 times the amount of body weight. And the knee really only sees anywhere from 3 to 5 times, and then the hip even less. So the ankle takes quite the amount of abuse.
Which is really pretty incredible, because people always think knee replacement, hip replacement, but in reality you're saying that your feet and your ankles actually take so much more impact. I had never thought of it that way.
It shows you how well designed they are and how important it is when the alignment or the design fails, which can happen due to injury, it can happen due to attrition, it can happen due to, as Dr. Bernstein alluded to earlier, systemic diseases. And so when those get out of whack, it's no wonder why the foot causes so many issues.
Speaking of issues, Dr. Bernstein, what are some of the most common issues that you see in patients with the foot and the ankle?
Sure. Well, it kind of depends on what time of day and where I am. So, you know, my life is, my professional life is split across different venues. So during the day, I'm in the office and I'm seeing simpler problems. Plantar fasciitis, deformities of toes, small fractures, things like that. At night, it's a whole different ballgame. I'm generally in the hospital when I'm on call, and I'm treating more serious things, fractures, limb-threatening infections, even infections that can cause risk of life. And then I also, about half my week is spent at the wound centers. St. Luke's has wound centers at most of the campuses, outpatient wound centers, and I spend a lot of time there. So of course at those centers I'm treating people with chronic wounds, diabetic foot ulcers and leg ulcers and so forth.
It's a really wide variety that you see throughout your day.
Sure do.
Matt, I want to ask you a little bit about physical therapy and the role that it plays in foot and ankle care. You know, when people come to see you, what are they commonly coming to see you for, and when is physical therapy most appropriate before maybe we see one of these doctors?
Yeah, so a lot of people come in with ankle sprains. We also see a lot of heel pain, and also people who have possibly fractured their ankles and needed surgery, and then we see them post-operatively to try to get them back into normal function again.
If they've seen you and whatever is happening is not something that can be healed just through physical therapy and they actually need surgery, you know, Dr. Lockman, how do you determine when surgery really is necessary for foot and ankle pain?
That's a difficult time, right? It's not a decision that I make, honestly. It's a decision that I make with the patient. So if the patient's quality of life is being affected, you know, every single step, then I think it's time to consider surgery. So for instance, someone who has tried all the non-operative treatments, including seeing Matt for physical therapy, whether it's orthotic-based or just shoe wear modification, activity modification, if they have tried all the things that we know can make a condition better, but that condition has not gotten better, and their quality of life is affected negatively enough to warrant the recovery, because every foot and ankle surgery comes with a significant recovery, then that's when I recommend that a person consider surgery.
Certainly if you've exercised all of your options and that becomes the only way to maybe not live with pain anymore. And Dr. Bernstein, you treat a lot of chronic conditions. Tell us a little bit about what those chronic conditions are that can affect or negatively affect the foot and the ankle, and some of the ways in which you can help those conditions.
So what comes to mind is diabetes, as that's the biggest problem that I deal with. It's a chronic condition. It affects a good half of my patients. And so, from a perspective of it causes a lot of problems that we've talked about already: foot ulcers, infections, if things aren't handled appropriately, even partial loss of a limb or even partial loss of a foot. And the way we handle those, there's really two parts to that. In the chronic way, once we've got that acute condition under control, maintenance. That means seeing us frequently, a lot of education to teach the patient how to take care of themselves and prevent causing problems or unforced errors where they, for instance, walk barefoot outside and burn their foot on the pavement, things like that. And then acute problems, of course, that's where the training comes in, that hopefully the surgeons and physical therapy, we can use our education to put those fires out, whether it be a foot ulcer or a bone infection or a fracture.
All right, this has been great, insightful information from our panelists, but we're not done yet. After the break, we're going to learn more about various treatment options for foot and ankle patients. You're watching St. Luke's Health Now.
The thought of my leg being amputated made me feel very upset. As a diabetic patient, I'm more prone to more serious injuries to the extremities without really knowing it. And one night, I had a series of very painful episodes. And when I woke up that morning, my right foot and leg were swollen. I was directed to Dr. Bernstein, and he diagnosed it as a Charcot foot problem. Unbeknownst to all of us, the bones inside had really started to deteriorate, and I developed sepsis. At that point, there was a good possibility I was going to have an amputation. I was working with Dr. Bernstein to see what we could do to save it at all costs. I had the ankle bones removed, and then I had follow-up surgery wherein Dr. Bernstein applied an external fixator. And then it was a case of waiting for the prosthetic to be designed and built. Without the care from the St. Luke's Health Network, I would not have my leg and foot today.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have an interesting show for you tonight. We're talking about the various treatments for the foot and ankle. In case you're just tuning in, I'm joined by 3 St. Luke's medical professionals, Dr. Lockman, Dr. Bernstein, and Matt Babbitt. Thank you all for being here. In the first part of the program, we talked about the basics of foot and ankle treatments with our team of St. Luke's specialists. Now we're going to dive into different treatment options and the technology available. So Matt, I want to start with you this time, ask you a little bit about what are some of the techniques of physical therapy that are used to help patients that possibly have foot and ankle problems or are recovering from surgery.
Yeah, there's a lot of different things that we utilize in patient treatment. Probably the biggest thing I think is just hands-on treatment, trying to mobilize joints to move better, to try to decrease stiffness. There's also muscle training that goes on too. Some muscles might not be firing correctly. There are also modalities that we can use too that help with swelling and pain, like cold laser. We're using a lot of that, electric stimulation, and some of those things.
And then I would imagine some patients you're able to give some exercises and things that they can do at home to help sort of with that muscle conditioning.
What really matters the most is what you do when you're not here.
Dr. Bernstein, there's a condition called Charcot foot. Can you tell us a little bit about what that is and how can it be treated?
So you picked my favorite question. I really started treating Charcot feet about 5 years into practice because what I found is these patients were not being diagnosed properly, and even when they were, no one really wanted to treat them. And what it is where basically the patients have fractures and breakdown of their foot and there's very little pain. So if they're not diagnosed properly, they'll continue to walk on it and their body weight will naturally start to cause deformity of the foot and ankle, and they can get really terrible, almost grotesque deformities of their foot and ankle without any pain at all that can lead to loss of the limb. And so if it's diagnosed early, it's simple as putting them in a cast and putting them on crutches or a scooter, and it will resolve with very little problem, no need for surgery. In my practice, 75% of people with that don't ever get surgery. I think it's because we do such a good job at St. Luke's at that. I mean, Jim and I work as such a team together. We're constantly communicating during the week about patients we've seen with this condition and making sure they're being treated appropriately. And I think we're really good at making an early diagnosis and saving a lot of people from limb loss and surgery.
You mentioned working together with Dr. Lockman, and if it's found that a patient does need surgery, can you tell us a little bit about the minimally invasive techniques and technology available to patients now?
The options now with minimally invasive surgery allow us to make an incision that's basically not even visible to the patient because it can be on the plantar surface of the foot or the dorsal surface of the foot, and just realign the bones through percutaneous techniques. And that's an exciting new way to fix a traditionally open problem.
And I would imagine that the recovery time for that is much less for the patients.
So scarring is less, range of motion is better early on. I think that overall it's a less traumatic experience.
Matt, you tend to see the patients a lot after they've had some sort of procedure. And what are the different recovery times, and do you see a variation based on the techniques used?
Yeah, so generally, the more involved the surgery is, the more swelling they may have, the more stiffness, and the longer the recovery. So one of the things that we try to do early on is to manage the swelling or edema and start to get things moving again the way that they should.
Dr. Bernstein, one of the things that you specialize in is limb salvage. Of course, that I would think would be the goal of all patients because, of course, amputation is probably a last resort. Can you explain a little bit what this is and when you can use it?
Sure. So that is where my fellowship training, that was what we dedicated the entire training to. And it generally would be broken down to recognizing and treating limb and life-threatening infections that happen in the hospital. And we do lots of that at St. Luke's, where it's amazing how bad the infections can be and what a multidisciplinary approach with our infectious disease doctors and our vascular specialists at St. Luke's, how we work together as a team to save feet.
It's really incredible what all of you can do for people with foot and ankle issues. Now, Dr. Lockman, the thing I'd like to ask you is, how important is the communication between the team and all the people involved in every patient's care?
We have been able to establish a very comprehensive foot and ankle program at St. Luke's, from the podiatry side to the physical therapy side to the orthotic side. So we are in constant communication. We share patients. Things fall into my world that maybe don't fall into Brent's world. Things fall into Brent's world that don't fall into my world. I think we have a really symbiotic relationship, and so it's been very effective since we text each other pretty much every single week.
And really excellent for overall patient care. I'm so impressed with how many options there are out there for patients. It's good for people to know. So thank you so much for such an engaging conversation. Up next, we're going to take questions from our live studio audience. Stick with us. You're watching St. Luke's Health Now. Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our amazing panelists. We've had a great conversation about foot and ankle treatments at St. Luke's Orthopedic Care. Now we're going to take some questions from our viewers. Are you guys ready? All right, I'm going to read the question. Whoever is best equipped to answer it, please speak up. Since I self-diagnosed plantar fasciitis in my left foot a couple of months ago, and then sesamoiditis on my right foot, through either learning to compensate for them or getting used to them, can these improve or go away for good soon or eventually? And by certain action by me or just passing of time, or do I need treatment?
The earlier that you get treatment, the better, and the more likely you are to resolve the issue in a timely manner. A lot of times people have that thought of it's just going to get better, and then 6 months down the road they're still dealing with it, and it might have even gotten worse. But we do encourage people to address the issue and don't just ignore it and think that it's going to go away. It doesn't mean you're going to have to go to weeks and months of physical therapy. It might be 1 or 2 visits that we can show you things to do, and that will help.
All right, next question. Is walking barefoot better for you, or is it prohibited as you age?
This is something I'm passionate about. I think the barefoot running movement was one of the best things for orthopedic foot and ankle clinics in the country. I think that a shoe is designed, in most cases, good shoes are designed to protect your feet. And so after most foot and ankle surgeries that I do, I don't permit barefoot walking for the first 3 months. It's just something that puts a little bit too much stress on any of the things that we do in the operating room. As far as barefoot walking, it's something that you can do at night when you get up to go to the bathroom, in the middle of the night. It's something that you can do around your house. But if you're having issues with your foot, specifically forefoot problems, a forefoot problem is happier in a shoe. And so I always recommend, against barefoot walking for anybody that has found their foot to be a problem enough to find themselves in a foot and ankle clinic.
Okay, good question, good answer. We have a question here about what's covered. So Matt, I think this might go for you. I've been experiencing some foot pain and I'm not sure where to turn for help or what my insurance will cover. Where do I go?
Well, obviously I can speak to physical therapy, and fortunately St. Luke's participates with all insurance plans. For the most part, physical therapy should be covered. And so that's a good place to start, because from there you can get further treatment, further recommendations. Again, it doesn't always have to be a long, drawn-out course of physical therapy. Sometimes just even a few visits can be beneficial.
All right, the last question I have is, Dr. Lockman, I want to ask you a little bit about a full ankle replacement, because we know that we get our knees replaced and our hips replaced. Can you get your ankle replaced?
You can. You've been able to do that since 1987, but the success rates were very poor in the early generations of total ankle replacement. Ever since about 2000, so the turn of the century, we have had a three-piece ankle that's been available on the market that now has 19-year data. And the 19-year data shows that there's a 87% survival rate with the originally implanted implants. So the technique has been refined, the implants have been refined, and this is refined through past mistakes. So a lot of people have horror stories of early total ankle replacement. But over the last 15 years, it's really become a very successful procedure and a very satisfying procedure as a surgeon to do, because those are typically the happiest patients in your clinic, the ones who have been dealing with chronic, debilitating ankle arthritis, and you can alleviate that with a surgery that takes us about 1 hour and 15 minutes to do.
Well, it is incredibly impressive how many different techniques are available to patients for such a wide variety of foot and ankle issues. Thank you all for being here and educating us a little further on this topic here tonight. Thank you to our studio audience for being here and for your very, very insightful questions. For more information on foot and ankle treatment at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-St. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.